I guess we'll go ahead and convene as the Board of Health. And our first action item, interestingly, is an action item for the board to take action on voting to close the hearing to discuss litigation for the Board of Health versus Calumet LLC, doing business as Schools and Social Club. So with that, we're looking for a motion by the board to temporarily close the meeting to discuss litigation.
I move to temporarily close the meeting to discuss litigation strategy.
Any discussion on the motion on the floor? Any public discussion on the motion on the floor? All in favor of closing the meeting, say aye.
Aye.
So moved. So now is when we close it.
But we can see it's not the best.
All right. Well, so we're going to reconvene as the Board of Health, and our first action item will be action on a motion regarding settlement conference on Board of Health versus Calumet LLC, doing business as Schools and Social Club. And do we have a motion?
I would move to appoint Ross Miller as the Board of Health representative and James Stevens as an alternate to attend and act on behalf of the board at the settlement conference scheduled for August 6, 2018. The board representative is authorized to enter into a reasonable settlement in accordance with a consensus decision with the department, county attorney's office, and board members present at the conference.
Great. Any board or staff comments or discussion on the motion? Any public comments or discussion on the motion? Seeing none, all in favor say aye.
Aye.
So moved. All right, thanks everybody. Thank you
Thank
very
you.
much. We're getting, I don't know if it's unfortunate or not, but we're actually kind of getting good at that. Deal with the meeting requirements for discussing litigation. Third action item is May minutes. Do we have any minutes? Okay, so.
Which one's the ones you?
Water.
Yeah, I just saw water in there. So with no minutes, we'll move on to item number 4, monthly update on strategic priorities.
Kate Avenue.
So first one is going to be Kate with Section 1 population status.
Hi. Hi. Does it matter? Do I need to sit by the mic? Okay. And my apologies for sticking my head in earlier.
Oh, that's okay. It's it's very unusual that it would be a closed meeting.
Right.
Were you waiting for the puffs of smoke to come out?
It's not allowed.
That's right.
Separation of church and state.
Okay, let's see. My eyes tend to be good, but I haven't.
This is very difficult. We've got it. I keep saying we're going to do something different.
Slideshow.
It's off the screen, yeah.
If you, here, oh, it is.
Yeah, we did
There.
it.
It's down below.
Got it.
Yeah.
Okay. Right. Hi, everyone. I'm Kate Devino. I'm the WIC and Nutrition Unit Manager. And I'm giving an update on 2 goals today, Goal 3 and Goal 4 within the nutrition part of the population health status, Part 1 of our strategic plan. And I will do my very best to stay within my time. I might talk fast. So our Goal 3 is to increase the percent of WIC eligible families that are enrolled in Missoula County WIC to 50%. WIC is the Special Supplemental Nutrition Program. You can see who it serves. I think you all are familiar with the program, so I won't go into too much detail. Our indicator on this goal is the percent of eligible families served. And I wanted to point out that the American Community Survey no longer provides this county-level poverty data by age category that's appropriate for WIC comparison. And so we no longer really know what our eligible population looks like. We recently changed our performance measure on this same measure to simply say to increase caseload. And so the essence of our goal remains the same, but it's not really measurable as written. So I just wanted to point that out. So
what's the income cutoff? Sorry, I shouldn't have interrupted. What's the income cutoff for WIC?
WIC is 185% of gross income, so 185% of federal poverty level, which is
$27,000.
It's about $45,000 for a family of 4.
Okay.
And I'd be more than happy to provide a lot more details about who we can serve and what the program.
I just wanted to calculate if our decreased unemployment rate would impact that, but it's not going to bring it anywhere near that number, so it's fine.
No, and I'll mention a little bit about that.
Yeah.
But yeah, we don't know really what the pool of eligible
Yeah.
are. We know that women participating in pregnancy Medicaid are adjunctively eligible, and we serve about 72% of that population. And so that's really where we can see what that pool looks like. In year 3, we aimed to develop an outreach and referral system among healthcare providers. We had some ambitious objectives within this goal. We did not accomplish all of the actions. However, building on presentations that we made last year to 23 providers within 3 large offices, we did complete some things. We have a presentation template that is finalized, and that may sound simple, but it was actually not simple. We have a presentation scheduled with partnership at the end of July, and then we have 7 requests out to 7 different providers that we're waiting to hear back from to get in the door. We have some additional to-dos to finalize. We have some assessment and evaluation components to establish. And then we've really identified some barriers. It really is difficult to get in with providers, both due to their time and due to our time and availability. We also don't really know what providers need to know, and we haven't had good access to ask them and find that out. And then recent state funding cuts have caused offices to be very preoccupied with those cuts, and the timing to get in the door to establish kind of a broader system of referrals has not been the best timing this past year. This is the end of our official strategic plan, but these areas of focus remain a priority for WIC, and we will continue to work on them into the future. Objective 2 was to continue and finalize our QI project on reducing the missed appointment rates. We have quite a high no-show rate among our WIC appointments, between 15 to 70% per day of missed rates, so it's quite variable. But our initial pilot was focused on customer service improvements and adding a walk-in day. And we found that when we piloted the walk-in day that it was an alternative to scheduled appointments. That was the goal, but what was ending up happening is that clients were still scheduling an appointment, missing it, scheduling it, missing it, and then opting for the walk-in day. So it wasn't really serving the purpose. And what we've done now, we're adapting this current year, and we're changing our scheduling options, so we're not automatically scheduling people 3 months out. We're saying what works best for you. Can we call you a month before your benefits are due to schedule you at that time? The clients that we serve in WIC commonly, there's a lot of instability, and maybe they don't know their work schedules, and so it's really hard to schedule 3 months out and make the appointment. So we're trying to recognize that a little bit more.
So one thing they've used in some places, even to help people take their medication or get to appointments, are texts. Do we do that at all?
We have automated appointment reminders that go out 48 hours in advance, and it's either a phone call or a text depending on client preference. So we're working on improving those and changing our automated reminder systems to best. We were looking at some research that shows 2 weeks out is a good amount of time in addition to 1 day out. So yeah, we're looking at that too. So far we've found anecdotally that the scheduling option seems to be working well, but we have a detailed tracking system that we're going to put into place and really track our data for July and August, and we'll evaluate in September. So despite all of our efforts, WIC participation continues to decrease. At the beginning of our strategic plan 3 years ago, we were serving 432 clients more than we're serving now. That's an average monthly, and so that's a decent decline. And this is just a comparison. Our decline does follow national and state level trends. Agency in green is us, Missoula County, and then in yellow, state is the state of Montana. And so this is percent change. So in fiscal year 13, we had a percent change of -1%. And so you can see that our rate of decline is higher than the state on average. And so we are also looking at trying to figure out what's unique about Missoula, what's happening in Missoula, that our rate of decline is greater than in other areas.
Do we reach out in Sealy Lake or Clinton?
We have a monthly clinic in Sealy Lake. We do not currently serve Clinton directly. We do have a lot of folks from Clinton coming here. We have every other month we have an outline clinic in Drummond. We serve Granite County through Drummond. And then we have once a month at University of Montana and in Lolo. And then we have weekly at Missoula Food Bank. And that's been a very successful clinic. Our caseload has been it's grown significantly there, and that's a very popular clinic. There's easy parking, and people can do their food bank shopping at the same time.
And there's a playroom for the kids.
Yeah.
I probably know 20 families that have no idea they qualify for WIC, but based on their income, they qualify. Could we partner with the grocery stores and figure out how to do a flyer where it's in the store and it's like, if you hit these things, you qualify for WIC? Because they have the WIC qualified stuff, or they used to, I don't know if they still do. Like next to the milk and cheese and stuff, you used to see those signs. So it might be for increased engagement if people even knew they qualified for it, because I had no idea it was as high as that.
Yeah.
So.
That's a really good idea. We've been able to put up flyers in like the bulletin board areas, and when you walk into the grocery store, they don't like us to put things on the shelves.
Yeah.
And those WIC approved items are not. Some stores are really good at updating those. Some stores aren't, and so that's not really a reliable even to say that this food is for sure a WIC approved item. But I'd love to brainstorm a little bit more with you if you have some ideas of some outreach that we can do.
It's guaranteed revenue for the store if they can increase people using WIC where they might buy stuff they normally wouldn't get, and the store just gets the money, so they shouldn't care.
They could just put a little doodah in the grocery sack with every person that came through. And then
So have you had outreach to the grocery store owners like you're trying to do with the providers? Have you given presentations to them?
We have, and we also just last September transitioned from paper coupons, paper vouchers, over to electronic benefits. And so there was a big change, a big transition within the stores, and working with the managers at the stores and the cashiers to do trainings on how that worked. And throughout that process, there was a lot of education about the program, and the food package is constantly changing as well. And so there's been some of that. It's, we're still dealing with trying to overcome some stigma and some challenges that cashiers may impose. And for the most part, we don't see it very often, but it still exists, unfortunately.
sometimes it happens to people behind you.
However,
Yes.
All these ideas are great and great to hear again, or for the first time. But I just want to zoom out a little bit and say there's some other, and I know you've been reading some of this research. I'm not using your 5 minutes. I'm using the unassigned 5 minutes.
My 5 minutes is done.
Yeah, I know, it's like 5 minutes, but the board is engaged, and so we're just trying
Yeah, it's
to.
wonderful.
We're not used to looking at trend lines that all go down. And what we're talking about how to go down less. But when you look at, if you put the national lines up there too, the national bars, they're down.
Mm-hmm.
So this is a very old program. And while minor things that seem major, like an EBT card, it just seems major, have changed over the years, what about that methodology or belief of the generations that used it when it was first created and the evidence base was created? What has changed? And it's got to be, all sorts of generational things have changed. So I'm really curious about what the zoom out picture is, because we can quality improve it a lot, and that will help. That matters. But the whole nation's going down.
I know most people, from my experience, if they don't feel like they qualify for SNAP, they don't think they qualify for anything else. So if SNAP is way lower in the benefit structure, I think they'll totally, if they don't qualify for food stamps, they're not going to believe they qualify for something like WIC.
Mm-hmm.
And so I know the amount of people that qualify for food stamps has been going down in a lot of municipalities. I don't know about here, but that just might be that association, I don't qualify for these other benefits, why would I qualify for these ones?
But it's, the disparity in the economic groups has grown, and I mean, I'm old enough to remember when we had waiting lists on WIC, okay? So this is something very major about the model, or how the model doesn't serve who it's intended for, has to be adjusted.
Some of it is the national mindset.
Could be.
I think so too. I was
Just
just, that's what I was
a bunch
just
of
gonna say.
mooches, that's kind of.
Could be.
Well, there's,
The stigma
there's
could
a lot of
be-
stigma, and people, people are not nice to people when they go to the grocery store.
Maybe we ought to
and
push
they're
it from a
using
health
the card.
benefit for proper brain development and stuff. Instead of supplemental nutrition, maybe it should be pushed in
Yeah.
terms of making
Different way of
it, this is how you make sure your kid's healthy, and this is to help, because healthy communities make everything blah, blah, blah better.
Yeah, that's a lot of our message.
Yeah.
Yeah.
There's a lot of things that have changed. And we've done surveys, we've asked people who have dropped off the program, what are the reasons? And a lot of the reason is that it's not worth their time to come in well, and actually, if they're not high risk, they only have to come physically in twice a year. They can do 2 of their appointments over the phone, or there's a app that they can do nutrition education on an app, and with the card, you can just load their benefits remotely. But we definitely see that SNAP is easier to access, and right now, SNAP is providing a decent amount of benefits. There's a lot of cuts that are threatened right now for SNAP, and if we see those go through, I suspect we'll see our caseload go up. But the other piece of the environment is we have such a rise in children in foster care and drug use, and I think that is a contributing factor as well. It's concerning, though. Our funding is tied to caseload, and we know we're not serving everyone that is in need of the program. Despite employment rates going up and poverty rates going down slightly, we know we're not serving everyone who's eligible.
I'd love to talk at some point again about engaging with the faith-based organizations in Missoula to get this information out there too, because I know lots of the congregations here, they're not above that $45,000 a year, and they have multiple kids, so they most absolutely should be qualifying for these benefits as well.
Yeah, that would be great, and even the idea of doing some focus groups with some folks and finding out some more information about barriers. Yeah, thank you. You're ready to move on? The second goal that I'm talking about today is Goal 4, to improve the school nutrition environment in Missoula County through collaborative relationships with community stakeholders. This is a cross-divisional goal with health promotion and nutrition, working together with community groups, mostly the Missoula County Public Schools Graduation Matters Student Wellness Committee's nutrition work group. I love that. I'll try to repeat that. So in the first 2 years of our strategic plan, we focused primarily on MCPS schools due to established relationships with them, the existing structure of the Graduation Matters Student Wellness Council Nutrition Work Group. And so in the third year, we plan to reach out beyond MCPS schools to some of the more outlying schools. And so we plan to work with 3 schools, Lolo, Frenchtown, and Hellgate Elementary, to initiate development of USDA's school wellness policies. USDA has set requirements for school districts to be in compliance with their wellness policy around both nutrition and physical activity components. And let's see, so we had numerous objectives here. We met with Lolo and Hellgate Elementary superintendents to offer assistance, and they were aware of the policies, and we have not heard back from them. We plan to check in with them again in the fall. We've had less interaction with Frenchtown, and we're hoping to focus on Frenchtown moving forward next year. For Smart Snack assessments in each school, Smart Snack compliance is mostly applies to school stores, and we've learned that Lolo and Frenchtown don't have school stores, so that's an easy check off. And we haven't, again, gotten into Frenchtown to know what's really going on there. And then encouraging options for expansion of best practices, such as breakfast after the bell. Breakfast after the bell is a best practice way to offer breakfast without stigma. It's universally offered in the classroom to everyone. But schools need to have enough kids that are free and reduced eligible in order to make it financially feasible to provide that option. Otherwise, their reimbursements aren't enough to pay for the program. None of these 3 schools have that, are at that level where they're able to provide universal free meals. And so some things like breakfast after the bell is a little bit more challenging, but we're gonna, as we start working more, we hope to start working more with these schools, we'll explore other options for best practices and other ways to improve the school nutrition environment. Overall, we didn't accomplish as much as we intended to on these activities in the past year, and there's been a variety of reasons. One, we really followed an opportunity and focused on an opportunity with MCPS that I'll talk about in a minute in the next objective. We also had a key full-time staff person out unexpectedly for over 3 months, and so that kind of set us back just a little bit. And then we really underestimated the importance of strong relationships within the schools to get in and do some of this work. And so that's an area that we need to work on more to get in and do some more work in these areas.
So just to add to Frenchtown, my grandkids now go to Frenchtown. And the one really, they've all been now diagnosed that they have celiac. So you have to watch what you eat, and so they can't eat school lunch most of the time. But Frenchtown has this amazing, in the afternoon, there are these bowls of fruit all over the place, I guess, that kids take fruit. And I've also been hearing from people who work in the big public school here that, you know, kids often, they want to get outside and play, so they take one bite out of that apple and throw it in the bucket, throw it in the garbage. So maybe they'd be better off to hold the fruit and give it to them at
After
2
recess.
o'clock. Yeah.
Yeah.
It's like having lunch after recesses.
But the fruit is free in Frenchtown, so it's great because it takes the kids a while to get home on the bus. So they can't say they didn't have anything, and it's a choice that any kid can eat, mostly.
And I have an opposite experience with the breakfast after the bell with my kids at Chief Charlo. And they get served and told a Pop-Tart's nutritional and healthy and whatever, and it's just a big brick of sugar and has new things. And honestly, lots of kids have control issues, so if they get fed a balanced meal at home, and then their teachers are forcing them to take the food in the classroom so they can make sure they get the grant for next year. So every kid is required to take it whether they want it or not in my kids' classrooms, both of them. And so I've had a very high level of upsetness about that, because I'm like, my kids don't need to do this. I provide them with food. It's okay, they don't need to take the food, but they feel obligated to take the food from peer pressure from their teachers.
And that's interesting. That's not the way the model is supposed to work.
I fully understand that.
I will follow up and look into that a little bit. And I think it's, you know, there's a misconception, a broad misconception about the quality of the food that's offered. And we were able to have a dietitian go in and analyze every single menu item and categorize them within the Go Slow, Whoa categories of the CATCH program. Go foods, you want to eat a lot. Slow foods, not as less slow than go, and then Whoa foods only every so often. And they're making a lot of improvements, and a lot of the foods that are served are not the same that you can go and buy on the shelves. They're manufactured specifically for food service, and they might be whole grain or low sugar, and so I think that's something that we're also working on, is trying to increase some awareness of what the quality of the food actually is. It's a really tricky balance, because if they have to provide food that kids will eat, and kids from all different socioeconomic statuses are at all the different 16 MCPS schools, and it really is, you know, how do you find that balance? So, but I appreciate that point.
It's just one of the things I noticed while they had to do this food and do this whole thing, and even my kids were kind of like, I don't want to take this stuff. So
Yeah.
I think the other issue you'll deal with on a lot of this nutritional stuff is what the USDA says is healthy is way different than what people, especially middle and upper class, believe by reading their blogs and whatever from that aspect, and what they believe is healthy. And so I think that's going to create a constant nutritional challenge between Board of Health and your requirements to probably follow federal guidelines versus what people believe is true. Not saying what is true, it's what they believe is true.
It's another area that we try to work on, is educating people about trend diets, and all the information that's out there isn't always reliable.
We're such a foodie nation.
Yes, yeah.
You can find something to support whatever you want to do pretty good.
Yes, exactly. And then it'll change next month.
That's right.
Yes. Okay, objective 2 is to work with MCPS schools specifically on providing guidance and support in achieving compliance with USDA wellness policy rules. So same wellness policy rule that we were looking at for objective 1, but specifically with MCPS. So these first 2 bullets really go together, and actually the second one happened first. we met with the superintendent of schools first in order to gain blessing and support for the work that we were looking at doing in the first bullet. So this work was mostly led by Mary McCourt in Let's Move, and Mary and an MCPS liaison facilitated a super committee that was to make recommendations on procedure changes that were required to be in compliant with USDA policy. And in addition to that, they also looked at best practices from other sources and really put together a very detailed list of procedures that the super committee is recommending that the administration adopt. So the wellness committee is really looking at finalizing these recommendations, presenting to the regional directors and the cabinet at MCPS. And this is a huge accomplishment. This is something that Mary says she's been working on for 7 years. So she retires at the end of this month for the second and I think final time. Yeah. And it's a really nice way for her to end her career on this success, really. It's not final, it's not approved officially yet, but it's really exciting work, and will really move forward in improving the school nutrition environment as well as physical activity. Physical activity is included as well. And then breakfast after the bell in MCPS schools, Lowell and Paxson both adopted breakfast after the bell this last school year. Porter is moving forward to adopt it in the fall, and Meadow Hill will likely follow. That will bring all 8 of the schools that are able to have universal meals will have them in MCPS after those final schools come on. And so that's a success as well. And then that last point of co-chairing the wellness, the student wellness nutrition pillar, nutrition work group, that is something that our Eat Smart coordinator has done for many years and continues to do. And many of us within our obesity prevention team here at the health department sit on that work group as well.
And that's the Graduation Matters, not General Motors.
Oh, yes,
Student
thank you.
Wellness Nutrition Pillar.
It's hard not to spell everything out every time, and then my own abbreviations, yes.
But that has been our way in. Only 10 years ago, we really couldn't get in. We weren't blocked out, but everybody wants into the school.
Right.
And then they want the teachers to do their thing for them. But getting on the Graduation Matters committees is how we've really worked our way into the policy changes.
And that's a piece that we've been missing in those outlying schools, is that
Yes.
Yeah. And really navigating that structure within the schools is,
So you worked with the superintendent at all, Lurkin?
We do on and off. It's largely tends to go through. I mean, she's very supportive of these types of things, but as you know, she doesn't have direct control. She has more connection.
Right.
So we work with her on connections to outlying schools. Once we get connections to outlying schools, we're less likely to actually directly interact with them.
So this is an area that we will continue to work on despite the end of our official strategic plan time period, and especially with those outlying schools. But this work with MCPS is, it's going to take ongoing focus and assistance and kind of, throughout the implementation process. So that's what I have.
Nice. Thank you.
Thank you.
Thank
Thank
you,
you for
Kate.
the good questions and good discussion. Yeah.
Great. Then next is item 5 on the agenda, which is to approve preliminary fiscal year 2019 county budget for the Substance Abuse Prevention Fund. And Ellen's going to
Okay. Brief reminder from last month, I didn't ask you to approve the budget because I do believe I was in a position to be able to state publicly that we were sitting with the union representatives at the table discussing the nature of the cuts in compliance with the employment contract, the bargaining contract. And so that was happening the very week that you were meeting. The cuts, I guess as a reminder, the reductions in budget were almost completely due to the loss of several federal through state to local, well actually to Western Montana mental health and then back to us. It was a very circuitous route to the forum. And those grants had been 5 years duration and ended, all but one ended at the end of June, and a very small one carries on to the end of September on the federal fiscal year. So that was $98,000 worth of revenue that we had for 5 years that we no longer would have effective July 1. We expected DPHHS to put an RFP out first in January, and then it was March 1st. And here we are, June whatever, and there's just not even word of an RFP. So we were not able to sustain current staff effective July 1, and I think it's a 20-day notice period if a person is likely to be laid off. So we worked through that for about a month with that particular union. Both this program is new to the health department in terms of its administration, because we just started administering the program a year ago, and their union contract is also a different union contract than the one that we usually have been familiar with. So that took a little bit of time to sort out. That said, the notices for reduction in force were given several weeks ago, and we went from 4.70 FTEs going down to 2.85 FTEs. One of those remaining FTEs is fully grant funded, and that's the one that's out at Frenchtown. Everything else is funded through a portion of the prevention mill levy that falls under the commissioner's authority for levying as well as for allocating. So with that said, we rebudgeted. In the meantime, we of course had to have our budgets into the county. They are not acting on them yet. But I was working on this very budget again yesterday, and the biggest news, is the cuts. But I will tell you that just about this time yesterday, I was into the operational aspect, the actual line item part of the budget, and we will be incurring a deficit this year. We were, when the budget was transferred to us, all of the cash for this fund had actually been budgeted to be spent. So that happened. So we had no capital reserve. And we're trying to restore a deficit and a capital reserve. So since we last met, we were given some contingency money from another part of the levy that does not affect any of the existing agencies that also get this money. And then I put a request in for that same contingency amount. It's a little over $11,000, so together it would give us $22,000 to help repair the deficit, as well as to begin to have a positive cash balance and put it in a reserve. That second $11,000 won't be acted on until the commissioners act on this year's budget. Yesterday I was in there cutting down operations significantly, because even with those infusions to the budget was way over, and there is room in operations, particularly with the reduced staff, to cut. So I don't have for you the exact amount of where operations stands now, but I can tell you it will change again, because until we get to the end of the budget year and we see what kind of termination reserves we have to pay it for staff who were laid off, we really aren't going to know where it lands. But it's much healthier now, 24 hours later, than it was yesterday. So I would do a middle zoom on this and say I'd ask you to approve the budget with the layoffs and with a reduction in operations to about half of what you see in front of you.
So is there any word about the money that's being returned to the state, and what that might look like?
I haven't heard any word about that as it affects this department. I've heard some rumors out there. I am aware that when the legislature had the special session, that rather than just accept the executive cuts that the governor made, they actually amended and wrote a new budget so that those cuts
Can't be
they can't be
reinstated
changed. Right. They're
without the legislature.
right. So even with the increased revenue, I think in most instances, I'm not aware that they can spend it. I'm also aware that there's a lawsuit that at least there's I don't know what the correct legal term is, if it's been, they can't make the 2.99 Medicaid cuts in some arenas because of a court decision or a stay. I think it's a stay.
It's just a stay.
It's just a stay, yeah, it's not a final decision. The money that we were hoping that we would have already applied for is, I heard yesterday, it's sitting on someone's desk for the RFP, but I've been hearing that kind of thing for months, and so unfortunately, we were
Because
not.
it's block grant money, right?
It used to be block grant, and it used to be something else, and I can't think of
They
it.
can't use it for other things.
No.
Necessarily.
No, but it doesn't necessarily have to go through all of those agencies and then come here. It was actually kind of unusual that it did come to the forum because of the way they're. So, what the staff are doing is meeting with all of the various forums, coalitions, task forces that were being managed or staffed by the staff who are leaving, and working with them about how to move forward. So that's the Missoula Underage Substance Abuse Prevention Group. It's the Neonatal Abstinence Syndrome Group. It's the Drug Take Back, or the Drug Take Back is one of the activities of the larger group. There's probably 2 to 3 more, and they're meeting with each of those. And several of them were already slated to have strategic plans done before we realized that we weren't going to be able to bridge our funding to whatever comes out next. So they will be going ahead with strategic planning for those smaller groups too, to see how they're going to move forward. We don't anticipate any of those groups going away unless the membership chooses to not continue to participate. But they haven't had a strategic plan, and well, I don't know when they had a strategic plan. So that's where that's at.
So just so you know, I've been lobbied by lots of them since staff was notified they were going to be laid off. That strategic plan can't be internal. It has to include external people, especially for MUSAP. I mean, you've got to have a big community discussion about that, because they feel like this is how they feel. Perception is reality. So they feel like all the decisions are being made internally in the health department without any input from the public. I'm just telling you how they feel.
Oh, no, I understand, and I appreciate all the interactions you've had and what our staff have had as well. But frankly, the state health department didn't move the money.
No, I know that.
And still haven't moved the money. Those will have to be external because those are strategic plans for those coalitions specifically. There's no other way to do it. Otherwise, you'd have a strategic planning session of one person, which would be your staff person. So that's where we're at.
So, I don't really feel like they're ready for us to make that motion. Because the numbers are going to be different.
Yeah, they are. I didn't realize yesterday but you know how the budget works now.
Yeah.
You put it in and then it goes into a new system and then you reconcile it. So I was called over to do some more reconciliation yesterday, and we worked a lot on that deficit. So if the board doesn't approve it, it's basically going to be approved after the commissioners do. So I guess I don't know how to look at that. We always put the budget forward before the commissioners act on it.
Yeah, I sat on the review committee that looked at your budget and saw quite a few things in operation that we thought could come down, so.
They're way down now. I was trying to hold on to.
We could do it next month.
If we have a meeting next month, we can do that.
The commission doesn't adopt the final budget till September.
The staff, not to argue with you, Jean, but the staff are trying, as of July 1, they will be operating on a reduced budget, however it's approved. Could I offer an alternative that I send the board the changes? I have to put them into a format that they can be sent to you, because I can't send them to you off the county system. And I can show you the reductions and the balance sheet or something like that. Or do that with the budget committee. I could share it with the budget committee, and subject to the approval of budget committee, because the staff really has to start, removing phones, phone lines, and just doing things that cut costs right now. Approving or not approving travel requests. And if they go by this budget, they're going to be thinking there's more there than there is. I apologize for the timing, but that don't control the county system and how it relates to this board meeting once a month.
Yeah, but the budget had phones in it for 8 people, and there's 4 people, and there's going to be 2, so I mean, there were some mistakes in it. I don't know how you want to do it. I'm fine with the budget committee doing it.
Yeah, we did take it down.
We don't have anything to take action on today, we have action on, we could take action on the number of staff. Yes.
That would be helpful. And I could send the reduced operations as of yesterday's budget. This is the county budget committee. I could send that to the budget team. And then you can see what the balance is looking like.
So could we, as then some kind of a middle ground, so that your staff isn't held up enacting the steps that need to be taken for the new budget reality? Could we not approve a budget number, but approve a budget kind of condition that we approve a budget that will be based on following a reduction of staff and following a reduction?
Right.
So this page is right? The
That
staff,
page is
number of
correct.
staff. So a
Right.
budget that reflects that
Yes,
staff?
that page is correct, and that is definitely in the format that, and these folks have already been notified, that is the format, that is the largest part of the budget. What I would propose, as Jean did in part, I would amend that if, I can't amend, but that you approve that and then defer to the budget team, and I will share the reduction in operations that we
To match
achieved,
these numbers.
that we achieved yesterday, which will also show you the bottom line. This budget isn't going to show you this year's deficit no matter how long you wait for it to do that, because it doesn't do that. So it can't show you this year's deficit. The county system that they have created as of this year can show this year's deficit and can show what we have to save next year to make up for it. And that's the work we did yesterday on budget team. And that is the spreadsheet I can share with you. I'm sorry, I just didn't anticipate yesterday's budget meeting when I was gone last week, so I did take advantage of the opportunity to go over and to try to improve the budget.
So I would move that we accept the FY 2019 personnel worksheet and defer the budget to fund this number of staff to the budget committee for approval. Does that work?
The second part I was requesting is to send to the, maybe you said this, the budget committee would get the operations budget, which also shows the total balance.
Right.
And that the board would defer to them on that if that balance does not look acceptable to them. Okay, thanks.
Works for me.
Any further, we got the motion on the floor, any further board or staff comments or discussion on the motion? Any public comments on the motion? Seeing none, all in favor say aye.
Aye.
So.
Thank you.
So I have a budgeting question, not related to any of this, but knowing that there's a huge fight going on with the Farm Bill and SNAP and all that stuff in the background, are there any other foreseen, based on what you know is going on out there, potential damages to the County Board of Health's budget that could occur out of the Farm Bill or anything else that's being thought about in Congress right now? I know they're talking about massive reductions in SNAP. I don't know how much that would affect us, but.
It wouldn't affect our budget, it may affect our demand and obviously the health of the population. That would take some time to see, but.
Is this WIC in the Farm Bill?
I thought WIC was in the Farm Bill.
It is USDA,
Yeah, so most likely,
It's in the farm bill.
yeah.
there's a lot of fights going on with the
Yeah.
Farm Bill right now, and no one knows what's
Yeah.
happening with it. I've read lots of congressmen lately to
Cool.
not mess with stuff. So I would, by the next meeting or the next meeting we actually hold, if there's something that's come out of the Farm Bill or a House version or whatever, I'd really like to at least have a 5-minute, hey, do we think this is going to really affect us going forward or not? Because I think there could be a lot more unforeseen cuts coming down the pipe depending on
Yeah.
what they do with health funding in the Farm Bill. And I'd like to maybe get ahead of understanding what the impact of
Yeah,
that
we would be affected by Affordable Care Act, changes to the Affordable Care Act, very, very directly in terms of our budget being affected, not just the folks we serve.
And that's likely to happen.
And as that
That is
gets
happening.
dismantled, whether there's a policy change at that changes who has insurance for immunizations and things like that, or who has insurance for anything, and whether or not they need our public health nursing services.
Well, as we're sitting here too, I just got a notification that the Trump administration's trying to move all SNAP benefits from USDA to Department of Health and Human Services. So, I have no
Well,
idea what that would do either, but I
there was a
like,
day we wanted that, but today's not that day.
No. No, you don't want that, but it's another matter.
Yeah, the other arena would be, really, it comes down to DPHHS. What DPHHS does with any other money, whether it's through legislative action or how they literally suck up federal money and do and don't dole it out locally, that affects us very directly. And it seems like we have less influence over that as the years go by.
Thank you.
We did get a small reduction in one of our smaller air pollution grants because of state cuts in EPA, because that's federal and state money. But nothing significant like we've seen on the health and human service side.
Expect more cuts on
Yeah,
EPA-driven stuff.
yeah.
We just have the money for one F-18 bomber, or whatever the hell they call them now, right?
Yeah. Currently $1 billion each or whatever. Check change.
Well, I guess at this point, we're ready to move on to item number 6, which is update on appointment of board member to the TPCC committee.
So Anna did go ahead and communicated with Jordan Hess, the head of TPCC, and then we had some subsequent meetings and conversations with the Missoula, or the Metropolitan Planning Office, and their perception of what wasn't going on. So then we had a 4-party meeting, and out of that arose, I believe, I hope, appropriate invitation to information about how you can go ahead and take the appointment that you have made. So I think we're there.
It's done, I've attended.
She attended, nobody booed.
The TPC actually didn't know about that brouhaha in a formal way, so having the opportunity to address it with staff that were transferring into a new position actually was a more appropriate way to deal with it.
Excellent.
So we're back to
Debbie is, again, having another meeting.
Started.
Yes.
Yeah.
She was welcomed on Tuesday.
Yes. And so,
Nothing was said.
Well, I'm glad that it worked out. All right, well, thanks for
Thank you for listening to all of that background.
That's all that, Gene, and when you were there. Making that get set back to right. So now we move on to item number 7, status of July and August board meetings. I think this is a discussion just to see if we're gonna hold board meetings, who's gonna be here, gone, or whatnot.
I'm literally in an airplane during the board meeting in July, so I can't even try to dial in on that one,
Yeah.
so.
And July's more iffy for me. August, I should be back. I don't know. Right now, both look okay for me. That July 19.
What is the August date?
16. 8/16. Usually I'd be gone July 23 through 27, but we just don't have anything scheduled yet.
Yeah,
And I've got a wedding at both times.
okay.
You're able to do both? So July's looking kind of iffy, and we don't have Dr. Stenger here, and
He said he would be here for July and August. And Jean, are you available in August? We have a no. Sarah Bell said that there was a conflict with their schedule.
Oh, I don't know what it is. I believe Sarah.
Things might have changed.
right now, especially, thank you for coping or indulging me to get the budget pieces moving, because I kind of anticipated we wouldn't have a July meeting, or that was possible, if not likely. It's looking like an August meeting is a little more solid for everybody,
Except me, which is fine.
except you.
So I didn't catch what your availability was in July then?
I'm okay in
Oh, you're
July.
okay in July, you're okay in July.
Sounds like I'm the only one, and you guys would still
Oh,
have a
so
quorum.
July may go
That should
forward,
be
and
fine.
August may not, or they may both go forward. And we do have that one variance that has to land somewhere.
Right.
So at this point, it looks like we're not in a position of having to cancel a meeting.
So are I can't remember the party that is applying for the variance, are they okay with July, or have they been?
I thought they said July or August is okay.
Oh.
They heard that back. Yeah, they actually, it was their, as you might recall, that was their request to not hold this
Right.
today because they couldn't be present. And the board actually has 60 days to schedule, not necessarily to hear, but 60 days to schedule. So, well, we have, 60 days to schedule. So if we can right now say that we're going to have the July meeting and watch the agenda and the quorum, especially if we do know you're not going to be here in August and somebody else was going to be in August. So I think I was reading it backwards.
So we know we've got 3, Jean, Pam, and Rob are all for sure's.
What was Julie?
I have her saying that yes, she wants to attend July and August. She was not here today because of
Her mom.
yeah.
Yeah.
So we have, it looks like right now we have 5.
And
And-
probably a 75% go for July.
It looks that way. We can always get down to it and see, sometimes, as you know, you manage to get out of the office for a long weekend and you want to go. And if the agenda allows that, usually Russ and I just check with each other. And
Okay.
so right now, July is a go.
So we'll go ahead and schedule for July.
And we will not cancel August at this point. We'll review again. Okay.
All right, sounds good. Sounds good.
Okay.
All right, so now I move on to the journal report. So which we didn't let Ellen do last time.
Yeah, I'm not going to bring it up on the, well, can you just bring it up on the screen? But I'd just rather talk about it from
Sure.
here, and then MCAT can see it. It's just one page, one graph. This is from the American Journal of Public Health, not American, the Journal of Public Health Management and Practice, their May-June 2018 issue. And it looks at the, I would say, suggested effects of accreditation on the population health. So it looks at the effect of accreditation on population health in a very indirect and early way. So lots of limitations, but kind of a way zoom out look. The findings are actually suggested, not hard findings. The findings are that the results suggest that accreditation may yield significant benefits and may help public health systems develop the capital that's necessary to protect and promote the public health. Well, and that begs the question it gets back to the question we had 5 years ago, why do we want to get accredited? We want to be a better department. Why do we want to be a better department? Because we believe if we're a better department, we are improving the public's health. So that's the whole presumption. The only study that's cited for this particular article in the footnotes that actually gives you some scientific basis, I'm sure there's others out there, but this article, that presumption is leveled on a study by Mays et al. Called Preventable Death Rates Fell Where Communities Expanded Population Health Activities Through Multi-Sector Networks. Lots of jargon. What they're basically saying is have a richer, more engaged, stronger immune system for your public health system. It's not just your department, it's your engagement with the community. It's leveraging what the hospital can do with what the health department can do with what the schools can do. So that engagement and reaching out is a big part of what grows a denser, multi-sector health department. So looking at the graph then at the top of the page, they used an existing longitudinal study, or at least the respondents to that longitudinal study, to determine if they were growing stronger indicators of a stronger public health system. So this graph has only to do with the public health system and how those entities, those systems, well, the entity is accredited or unaccredited. If you recall the accreditation history, the first availability of voluntary national accreditation was 2013. And so you can see on that chart, on the blue line, you can see that we can presume that in 2012, many entities were beginning to prepare for accreditation. So while they were being measured by this longitudinal study, and the factors they were looking for were very similar but not identical to the accreditation measurements. But they're very similar. They're the components of a public health system, such as engagement, use of data, scientific basis, evidence base, those types of things, policy making, all the things that you recall from going through accreditation. And once a health department got into the lane of going for accreditation, even if they didn't have it yet, they made that a cohort. They put them in the going for or being accredited cohort, whereas before they were all just one cohort, and there's a 20-year study. And you can see that after 2013, they started, by those measurements, seeing a more engaged, highly, much more multifactorial, all of those jargony words about a more sophisticated and more far-reaching system. And then again, the premise based on May's research is in other communities, before we even had accreditation, when they used the components in this study, they found lower preventable death rates. So it's a very far out zoom. It's more suggestive than indicative, but it is the first look, and you can see a nice diversion happening with those accredited or on their way to be accredited health departments.
Even with qualitative data, it looks like there's a big difference just having someone look at what you're doing. Someone looking over your shoulder makes you perform significantly better, it looks like.
Yeah.
But if it didn't start till 2013, what's the blue line before that?
The respondents that they used were already part of a 20-year longitudinal study. It had, let's see.
So it's showing the ones that went into accreditation before
Right.
they started, they were kind
Right.
of staying parallel with everybody else.
Right, so their N number, the participants over 20 years, has ranged between the respondents or the subjects, from 261 to as many as 331 health departments. And they're all health departments of jurisdictions 100,000 population or greater, We do not happen to be one of those health departments. So they used that group, and they were already looking at things like community needs assessments, use of data, investigation of public health events, involvement of elected officials, policymakers, community engagement, and evaluation, which then became the actual accreditation measures, but they're not identical. They were in their formation. So I thought that was timely since we're working on reaccreditation. Yep. Thanks.
So then, let's identify a volunteer for the July tournament report.
I'll be on the plan on that.
Yeah, exactly. I haven't done one for a long time. I'm doing that, but I can volunteer. So, and if I'm not here, I'll do it in August. So, all right.
Thank you.
All right, then it's item number 9, Director's Report and Accreditation Update.
I think I prepared this agenda before I was gone all last week, and so obviously I've come back and the budget has changed and the rivers have changed, but so the agenda is.
The river's back.
But the river's back.
Is it back up again?
Back up, yeah.
It's always right.
I guess it would suffice to say that the department was extremely engaged in all of the flooding response that I believe was incredibly well handled under the Office of Emergency Management out of the courthouse. And they engaged us in a way that I would say for the first time we felt very much a part of the working mechanism. And of course, what comes with that is you show up at all the briefings and you go to the night meetings, and that's fine, because it's easier to feel like you're a part of the mechanism than you're maybe stuck in the gears or you can't get in. And so I really credit Adrian Beck and others, Nick Holloway, Sheriff, everyone that was involved in that to keep us involved. We had an incident within an incident, which I'm sure you read about in the paper when we were looking at what was going on and trying to get the testing and the contingency plan for the berms out at Frenchtown. And we learned how to handle an incident within an incident. And we actually gained some ground toward prevention of more discharge to the river in future events. In that, the county commission was extremely involved, strong advocates, as well as other partners in the community like the Clark Fork Coalition and the tribe. So the department is still involved in what's called the recovery, which for now some people are not in recovery, they're back in flooding. But the recovery mode that operates both at the county level, and it has to coordinate and align with what FEMA benefits may be afforded to people. And I was gone all last week, so I actually don't know where we're at with that. And in the meantime, the river came back up with the rain. But at least we aren't Augusta, where they had a grizz floating down their flooded creek downtown, or near the town. Yeah. We didn't have any live grizz floating through, but we had a lot of other gook.
So the bad thing is where we used to think 10.5 feet is where we had to worry about the flood stage. It was at 7.5 feet this week, and it was inundating Kerwald.
Yeah.
The river channel has changed, gone back to an old one. So those folks are underwater again. About 6 inches of water on the road. They expected it being a foot by last night. I don't know if it was, and with that rain this morning, who knows. One of the issues down there too is just that there's septics.
Yep.
And the sewer does go down third at that point, so I don't know if that'll be part of the solution in the future or not to collect. But one of the interesting things also is that quite a few of those homes in that area are rentals, And so they cannot be counted toward the dollar amount for direct FEMA assistance to Missoula County.
Because they're rentals.
Not owned.
So once again, the more marginalized you are, the more disposable you are in terms of help.
I know. They don't count toward the numbers.
Really?
No.
That's crazy. But if it was a person's second home, it would count.
No, they don't either.
They don't either.
Second
Well, at
homes
least
don't
there's
I
some
did that for
equity there.
And fires, your second one doesn't count.
But the governor did ask for a presidential declaration, which can bring some different money, but nobody gets 100% of these deals, no matter what number we hit. 75 maybe. Yeah, we just put, we approved up to $67,000 worth of dirt for that road that is now underwater again, so we'll see. Hopefully it's stayed.
What was really neat is to see managers and others, members of the staff that are either new enough in that particular management position or in staff or haven't had an event, because, you know, many of what we do have to do with immunizations or something like that, just step up and find their way into that system. And again, I credit them, but I also credit that system became open and clear with good communication.
Well, we had some really great staff in all departments, but your staff was very obvious in their leadership.
The other thing I'd like to bring up is we do have to do a new, I believe, 3-year strategic plan. I have to tell you that since we've changed the community health assessment and the community health improvement plan to 5 years, and we did that because we were, in my opinion, getting more process than product. We were getting product, but the process was never ending. I'm not really sure if we should have a 3-year strategic plan. I know 5 years is too long for a strategic plan because we amended 1 to 4. But I am sure that as of July 1, we're actually supposed to be on a strategic plan, and we need to sit down and have what it's generally a half-hour session where we plan.
Half day, you mean?
Yeah,
Oh,
a half hour. We're going to do it in a half hour because
Strategic plan is
there's just no time.
bullets.
So we never do the whole day drudge. We usually do a lot of work, and we, with the new managers, they wish to engage their staff, learn how to engage their staff, do it differently. Probably going to need to look at a facilitator to do that correctly, or in a way that it's more open. But what I would like to do, and thank you for reminding me on our conference call as we prepared this agenda, Debbie, I would like to see if there's 1 or 2 or even up to 3 board members that would work with the management team as we prepare the actual full board strategic planning session, which we generally do like from 10 to 2 over lunch, have it facilitated, and we don't try to pre-orchestrate it, but we don't come to you with a white piece of paper. We come from staff up through our performance measures, our community health improvement plan, and we try to put things in front of you for your consideration for the strategic plan. And then the board usually also adds or takes a few items away. So if there was a member or 2 of the board that, and we would schedule it so that you could do some of that preliminary work with the management team, that helps us connect to the board and have a more informed session.
If you work with Sarah, you can, I'd be happy to do that too. Find times
Great.
in my schedule.
Great, thank you.
And I did it last year, and I can do it again. I just need to know the date because
Yeah,
I'm more than willing to help too, so
yeah, okay,
just let me know
Once
dates.
you set the date, we can.
Yeah,
okay,
because maybe each one of us takes a different department or something.
okay. Thank you. So we can't have 4, but we have 4 volunteers, so we'll look at 3 and see if it. if
Look
the
at
dates-
timing, and then that'll probably
See if
answer
the
all the
dates
questions.
work. Yeah, I'm sure it'll get down to 3 or 2. And you saw that I had put something on, your calendar to hold over the summer, and it just didn't work for everybody. So I'm going to try again to do some holds in September and put some more thought into this. So thank you for volunteering.
All right. Okay, that wraps us up with item number 9. So then it's public comments on items not on the agenda. Seeing none, board and staff comments on items not on the agenda. Seeing none.
Actually, I have a comment, question, or whatever. So, strangely enough, since people know I'm on the board, I've had like 1 million of the medical marijuana people approach me and be like, oh, what's going to happen and stuff. And one of the things that I've learned is it looks like almost none of them are in compliance with food production stuff because they don't go to the state and get their wholesale food manufacturer's license because the state's probably not going to do that, or maybe they don't have a mechanism. And so I think there is something that the Board of Health probably needs to consider over the next couple of months is that's how, and Canada's legalized it yesterday, right? So all marijuana recreationally, I think, is legalized in Canada. Yeah.
Yeah, they did.
So I think one of the things that, yeah, from a public health perspective at least, people are making food, and they can do whatever they want with the product. I don't care if people want to buy it, whatever. But that food part of it that they're putting their product in, I don't think is being properly regulated or properly ensured that it's safe. And so
Is most of it baked goods?
a lot of it's baked goods, a lot they put it in, they make can of butter, they do all sorts of stuff. I'm like, stop talking to me. But nonetheless, they all wanted to talk to me.
Well, isn't it, I mean, it's not unlike the food that's prepared for the markets.
I don't think it's recognized, but I'm actually writing a note to environmental so we can get together and talk
So
about
everyone
that.
I talked to said they do not have permits from the state and they do not have a cottage food manufacturer's license, which is what you need to do at the farmer's market. So no one that I talked to is being overseen by public health to make sure that food's being made
Are they
correctly.
selling it?
Oh yeah, of course there's,
Yeah.
to their medical patients because it's medicine, but it's just an
Well, that's
extract in
quality
food.
control.
So I think there's a risk to public health there from a food manufacturing public health perspective, because I don't
yeah.
think they're recording their temperatures for the refrigerators or any of that kind of stuff. And
Or,
so
yeah, I'm just going to sit here and say there's no avoiding your point.
it's.
So I am going
It was an
to-
unexpected series of conversations. Everyone
Yep.
talks to me because I'm a chemist, right? So they're like, "Oh, you're a chemist. You make food. You?" I'm like, "Yeah, federally illegal. Stop talking to me." But right.
But
And
there was some action taken in the last state legislature to allow that.
so yeah, so Metric has its
Then
own.
it didn't tie itself to the cottage industry.
Yeah, so there's
Well-
this whole thing called Metric, and they have to do certain testing, and that got changed in the last legislative cycle. And there's a couple labs that are doing testing on the product, but my concern is no one that approached me had any interface with
With
public
us.
health on how to make food. I don't know if that's all of them. I don't know if it's just the random, like 10 people that reached out to me did it. We were looking, and there's a whole DEA approved thing for industrial hemp and like protein meal and stuff that's approved through the state, that's approved through the DEA as well. So we were looking at that, and I think that's why people started talking to me, is we were like, can we participate in that federally approved program for industrial hemp, for protein, fiber, and oils and stuff like that. But yeah, everyone I talked to, no one even knew that county health had, they didn't know there was a state wholesale food manufacturer's license. They didn't know there was a cottage food preparation license you have to do if you sell it to farmer's market when you're under a certain size. So to me, it became quickly a red flag in May that I was like, there's a good chance for food poisoning here, in my opinion, or stuff not being prepared appropriately. And I know it's our job to keep the food safe. I know the state can do whatever they want on medicine or whatever from that aspect. But if it is going into food, I don't see it any different than, I'm sure we would force a pharmacist to follow all the proper rules if they were mixing
selling-
chemotherapy drugs or whatever into a brownie. I don't think they would, but I don't know. So, but I think it's something that we need to pay attention to because it is a risk to have a potential public health impact for Missoula County.
That's what I'm writing. We'll have a meeting, and my first attempt would be to report back to you what we do and don't know. Obviously, I don't know. Some people may know more than I do. I'm sitting here not knowing. As early as July, what we do or don't know.
I know what about 10 randos approached me about, and none of them knew that there was even these permitting programs out there for food manufacturing. Because
They
we
have lovely names though, like flour and things.
Oh yeah, it's very much their marketing's getting pretty good. I'm impressed. I kind of have no opinion on it because I don't like anything that slows me down, hence all the caffeine. But
Maybe we need samples.
then this would be a really hard and long board meeting.
Like I was saying,
Thank
there's
you.
no
My random
avoiding,
drug
no
test
avoiding, you
lines
make
are
a very good point.
Yeah.
So we will report back if you could slate that as early as July, but maybe August depending on how
I think the thing I would check is to see if the state law preempts county health from being involved, because maybe there is a separation I don't understand or didn't look into. So there could be one that exists that's like, oh, you don't have to follow any local rules. I don't know why that would be the
There may
case.
well be, and obviously I don't know that.
Yeah.
There are people that were sitting here earlier who may know that.
Yeah.
Sounds like
You
we
might
got-
still know that, Todd, having just come from the food team.
Yeah, they're specifically exempt from, the reason those people don't know about our cottage food laws and all that, they're exempt from it. So we don't have jurisdiction over
Interesting.
drugs that go into the food. It's all DPHS.
But do we have jurisdiction over the food
The food
that's
itself?
made and they put it
It's
in?
not food going into the public, so it's medicine.
Okay,
It's, yeah, it's.
interesting.
Yeah, they're specifically exempt from our rules, but the state DPHS, they still have to abide by them.
Yeah, they have a metric, I know they have all that stuff. So that answers the question.
Okay,
But,
Interesting.
yeah.
we won't be talking about that.
Yeah.
Well, we'll take a look at the exemption and whether we agree with it or
Yeah.
not. We'll get the law done. Glad you were sitting here because I was definitely caught unknowing.
Any other board or staff comments on items not on the agenda? All right, seeing none, we will adjourn as the Board of Health and convene as the Water Quality District Board. And I believe we do have the May minutes for the Water Quality District.
I would move that we accept the minutes as presented.
Any board or staff comments on the motion? Any public comments on the motion? All in favor, say aye.
Hi.
So moved. All right, so now we move on to Water Quality Advisory Council update. Todd's gonna answer that.
Thanks, everybody. I'm Todd Seib with the Water Quality District. You detecting me there? Okay. So I'm filling in for Travis today. Our last advisory council meeting kind of focused on Water Quality District updates to the council. So there's three kind of big topics. Smurfit Stone, as it related to the flooding and some of the berm inspections. We updated the council on that. The household hazardous waste progress, and if we're going to do an event this year, and if we're going to have a facility built soon, that was an update item. And then the city's stormwater facility plan, we wanted to talk to the council about that. So I'll just briefly kind of review some of those topics. Like Ellen said, beginning of May, we had a pretty decent flood here. Smurfit Stone would be covered by the lower Clark Fork River, and down there it was about a 20-year flood event. So I think we peaked at about 52,000 CFS down there. At that time, we had the JIC, the Joint Incident Command group started, and kind of a long-standing concern of the Water Quality District has been the berm stability. Those berms weren't designed to keep river water out of the mill site. It was, they were designed to keep stagnant wastewater from going into the river. So they are not engineered berms by any means. So when water started peaking around May 11th, we were concerned about berm stability, and we ended up getting on site in conjunction with Army Corps of Engineers and Newfields, which they represent the PRPs. And one of the things we noticed were what are called boils. And so a boil is basically bubbling water. It's water that's coming from one side of a source to another. In this case, water from the river into the ponds, through the berms. At that time, it wasn't really too concerning because they were called clean boils, so they weren't transporting material from the berms themselves. But it was still concerning. It still showed evidence of berm instability. We had some folks do some aerial photography and aerial video for us, and that was a few days later. And in those images, we noticed discoloration in some of the internal ponds. So like a cloudier water compared to the rest. So that indicated dirty boils, so sediment moving in there. At that point, a lot more attention and kind of visits to the site was initiated, and the Army Corps of Engineers helped direct a repair, and so the way they tried to repair it was with something called a ring seal. They basically surround that internal boil with sandbags to bring up the water level inside that ring, so the pressure from the riverside and the pond side get more equal, so you have less transport. But that didn't really work, and so a few days later they really sealed it with 3,500 cubic feet of soil from on site from another spot. So we got more drone footage of that progress, and that's when we noticed some strangely discolored water coming off site from Smurfit Stone into the river. If the river was looking like chocolate milk, this would look like tea. So like a, water that you could see through, but it was a dark color, and indicating a lot of tannins from the mill site were leaching on into the river. At that point, there was a lot more attention given. So Senator, not Senator Tester, Steve Daines and Gianforte wrote letters to the EPA, and we had the EPA respond with.
But it was actually Senator Tester's staff that called them directly, so.
Okay, so he
They
made the
took
call.
credit, but they were all involved.
They were all involved. It got a lot of attention. The commissioners were involved, and EPA, the higher ups in EPA, it definitely caught their attention, and the regional director of the Region A Supervisor. And so they sent out an emergency team. We worked with them on an emergency contingency plan for the site. It was really just a formalization of what we wanted to see. So, clear communication on daily berm inspections, a clear line of who they're going to communicate with, and then some, future, planning items for the site. Just because this whole emergency with Smurfit was not, that's not the end of the story. We wanted much more to happen afterwards too. So that's kind of where we were at, and one of our recommendations at that stage was to start doing some testing, of course, of the tea-colored water and of the ponds, and so we had some test results come back on that. It did show evidence of contamination from the site, leaving the site, specifically with metals, as well as contamination of groundwater with metals. So that's where we're at. We updated the council. The council definitely wants to comment on, future, the groundwater monitoring plan for this site, and that opportunity should be coming soon, and also comment on the berm stability results, which was supposed to come out mid to late June, so any day now we should have those results. The council's looking into commenting on that. So that was a Smurfit update.
So you mentioned a couple things. Did I hear that right? They said at the location of the Smurfit Stone site, they figure that was a 20-year event, 20-year flow event?
Right.
So how does that square with what we were seeing where both the above Missoula and below Missoula USGS gauging stations were reporting the second highest flows ever, the highest being 1908. So basically the highest flows since 1908.
Yeah, that's true. So the
CFS, it
was 100. So
there's the level, the feet, and then there's the CFS.
Well, that's what I'm wondering.
This was different, and so this was high, but this wasn't, so that at the complex.
That's why I was
That's what I
asking
think
is,
happened.
yeah.
above Missoula, it was the highest in 100 years, right? So since 1908.
Yeah.
But it wasn't a 100-year event. So statistically, a 100-year event is you have a 1% chance of having that event in a given year. And I don't remember what the.
Well, then what Deb's alluding to, or basically saying, is that this would be below the confluence with Bittera.
Yep.
That would be
Right.
below the below Missoula
Yep.
gauging station.
I think that's what it is, it's just that
And
those were at different rates.
The
and so they-
percentage that goes into making it 100, or that measurement is CFS, not how many feet above. Well, there is a distinction between the two measurements. One measures feet and the other is CFS. the 100-year flood stage uses a CFS number, and I can't remember, that's what you're trying to remember, what is that number that makes it 100-year?
Yeah, I know the.
But not feet above.
But I think they're supposed to be directly correlated.
They're correlatable. The lower Clark Fork, the 30-year flood down there for the FEMA flood maps is like 55 CFS, and we were at about 52, and I think the 10 to 15 was something like 47 or 48. So we were kind of right in between a 15-year and a 30-year flood on the lower Clark Fork, but yeah.
So that kind of shakes out, because when you looked at those flows, it looked like those really, really high flows were very localized to the stretch of the Clark Fork.
Part of it is because the Blackfoot was what was really dumping in, so I
Yeah.
suppose it lost some momentum.
Yeah.
And even above,
Okay.
Better it wasn't at that same time though.
but even above Missoula, it wasn't a 100-year flood.
Right.
It was like a 30-year flood.
Interesting.
I know they are correlated, and I don't know it very well, but there is a distinction that one of our talking points somewhere drawing of this, that the Clark Fork Coalition actually helped with publicly, was the distinction between the CFS and that
Gauge
percentage and the actual flood stage by feet. And I agree, they have to be correlated at some level, but there's some distinction in there.
Yeah.
The other thing is that the difference between the highest and the second highest is huge.
Oh, yeah, exactly, yeah,
So,
it's like
you know, it
17
just
feet to
didn't get
13 or
close.
something.
Yeah, it just
Yeah.
didn't get close to the 1908 height or CFS, so, yeah.
Yeah,
But
nothing that close to
that was concerning for us too, because it was misreported in some news outlets that it was a 100-year flood. And the reality is that it was such a smaller event, and they're still seeing,
Exactly.
instability with that berm.
Yeah.
So,
So then the other thing you mentioned, that there was other test results on the, basically I call it the tea-colored water event, if you will. So there was testing on constituents other than dioxins that did link the coloration in the river to the coloration of the ponds.
to the site, yeah.
They basically linked that, my understanding was that it was unclear whether the water was really coming from the ponds.
Yeah,
And so the water quality testing indicate that it was indeed coming from the ponds?
yeah, from the manganese is a very kind of specific thing we're seeing on that site. So manganese levels, arsenic levels, as well as copper levels were linked between the ponds, and the tea-colored water weren't found downstream, were lower in background levels upstream. It was, of course, we still think they need to do a lot more testing, but
It's my understanding that the issue kind of came up because the site's consultant did a one-time measurement and showed that the river was a foot to a foot and a half higher than the ponds, so they basically, the site was saying, no, the water can't be coming from the ponds, it has to be
Right.
going, it's actually going into the ponds.
right.
And the photographs, I mean, the visual was like, well,
Right.
you can see it's coming.
Thank goodness for
Right.
drones.
And those elevations weren't measured until after the water came down. So when the boils were happening, those elevations weren't determined. But at least the hydrogeologists on the council and other people we've talked to describe a situation that's a lot more complex in terms of just simple elevation. So, the Venturi effect of water rushing by and pulling.
Diurnal fluctuations in the water level.
And the fact that it was designed to drain
And it was designed to
in some conditions.
There's an outfall right downstream of where we
Yeah.
saw that.
Okay, so basically though, because what was reported in the newspaper was just the dioxins.
Yeah, so that interview happened before we had the metals data.
Okay, so this is the first I had heard that water quality testing actually established a link as well.
Yeah.
So the metals, is that like PPT that were detected, PPP, PPM?
Parts per million.
Yeah.
And they were, not just detectable levels, but above water quality standards. So,
Okay.
For the
So
metals.
Yeah.
Pretty heavy impact on the river then.
Yeah, what we were seeing
Yeah.
for the non-technical among us.
Cool.
So Yeah, the other two main topics, household hazardous waste facility, keeping the council apprised of that. And, that was just a quick update. Basically, we haven't done an event at the Water Quality District since 2016. Last year we didn't do one. And so we're still in the process of exploring a permanent site location. We've kind of added some new ideas to that process, including maybe on Republic property. How that's going to work, how that could work, we're not sure. You know, we would build it, they would operate it. We would build it, we would operate it, etc. So those are talks we're still having. But basically, the result was we probably should do another event this year. So we have one scheduled for September.
So two things I'd add to that. For one, I visited with Chad Bauer from Republic, and he's excited about the possibility. So I think we should keep working on that. The other is Vicki Zier had conversations with the city about the $70,000, and
She did?
They are not closing that door as long as it was either at Republic or here. They don't want to be that far out of town. They're not spending money that's way outside of town. So another reason to work with her.
How will they complete annexation? It won't be that far outside of town. They're gonna annex that whole industrial park, right? Isn't that
Well, they
what I
just
read?
feel like it's
So-
a convenience thing though for folks that they wouldn't drive that far.
Yeah.
And there's
So,
concerns from others that way.
so I probably have to take it out of the budget then, since we don't, they are not committing it.
Well, I mean, I think that they are,
That they
as long
are
as we're
committing
going,
it,
they
as long
are
as it's here,
committing, as long as
depending on
it's
where-
not
Where it's
out on Deja Lane. So, I mean, because I agree, I think that the Republic site makes the most sense to me, just because
People go
People
there
go
anyway.
there anyway.
So when you say here, what do you mean by here, other than Republic?
oh, the other one was the one by the.
The north side
Scott
one?
Street.
The north side one.
Well,
That was the two that they talked about.
pet peeve for me all along is, I just think Republic has been greatly under-participating in this all along. It prevents,
Lots of things from there.
it prevents their site from inadvertently collecting hazardous waste. That then becomes a liability for them, that then becomes a liability for our water supply. And for Missoula to be hit by on 1 or 2 days of household hazardous waste collection to stop the hazardous waste from going into that landfill.
Or out in the woods.
There are lots and lots of landfills that have daily household hazardous waste collections. Daily.
And I've seen at the rim and whatever, I've seen individuals throw what was obviously hazardous waste into that thing.
Of course you do. You see what's convenient.
Last time I was there, I saw someone chuck a bunch of big giant car batteries into that
You do what's
dumpster thing, so.
You do what's convenient. And, it's,
Well, those conversations are happening.
Republic needs
So
to step
they're-
it up.
Mhm.
Anyways, designated time. So was other items?
Oh, yeah, the last one was really just to inform the council and get their input on the city's stormwater master plan that they're proposing. And so the stormwater utility is, they are proposing their, I forget what they're calling it, it's like their operation and management, facility management plan, and we were asked, the Water Quality District was asked to participate in reviewing that. And so just a little background, basically the levies, the levy portion, the levy management portion of that master plan, there's a proposal in there to devote a large amount of money and resources to removing most, if not all, of the vegetation on our federal levees. So the Clark Fork and I think there's 2 levees on the Clark Fork and then the Grand Creek levee. And a lot of the reason for that was for access by the Army Corps of Engineers for inspections. And so there's a public law called Public Law 8499, and that is the rehabilitation program. And the Army Corps of Engineers will inspect the levees for that program, and if they pass inspection, then if we had a catastrophic flood, they would repair the levees as long as we were eligible for that program, remained eligible. Former law dictated that if you had vegetation above 2 inches in diameter on a levee, then you would basically fail the part of your inspection that related to vegetation management.
2 inches in diameter,
2
not
inches
height,
what did I
right?
say? Yeah, 2 inches diameter.
Yeah, I just want to be clear.
Sorry, yeah. But so that vegetation management approach was challenged pretty heavily by different groups, including environmental groups in King County, Washington, and California. And in 2014, there was basically a stay on that law. And so there's something called the WRDA Act, Water Resources Reform Development Act of 2014, which basically required that the ACE, the Army Corps of Engineers, review that vegetation management section. And what they concluded at that time was that vegetation management would no longer be a determinant for eligibility in that Public Law 8499. So you would not have to remove all your vegetation in order to stay, eligible for that repair money. And so that our concern as the council and as the Water Quality District was basically to make sure that we have a balance between keeping the levees, doing what they're designed to do, protect infrastructure, but also protect water quality. If you remove all the vegetation, you have issues with, temperature of the water, you remove good riparian areas, and nutrient uptake, and sediment collection, and a number of things that with bull trout habitat actually would be a direct violation of the Endangered Species Act and the Clean Water Act. And so a lot of the reason why these suits came against the Army Corps from these other jurisdictions was because they were in direct conflict with these other laws. So currently that's the status, is that you can still remove vegetation. There's some planning, I think, and some submitting of management plans that have to be in place by the utility in order to be okay with that. But the council is expressing their interest to have a more kind of seasoned approach, maybe a more compromised approach to levee management. And the Water Quality District is also commenting on that as well. So I think that's due. The informational session for that plan is the 27th to the committee, Public Works Committee. So we talked about that. I think that's kind of, that was kind of the synopsis.
So there is some good rationale for the size of the trees. Because when you have a big tree growing on a levee and it tips over and puts a hole in the levee, you lose. So, I mean, there needs to be a balance in there. Definitely, I'm thinking willows probably don't hurt, but big trees can end up with putting the levee at risk. So the Army Corps was here this week looking at the levees. I know they looked at the Orchard Home levee. There's $1 million worth of damage this year. They pay 80%, I think, to fix. But there was damage in 2011 also. So you do have to figure out a balance there.
Yeah, some of the research that came out of King County was showing that the native vegetation, the roots from the native vegetation, not only helps slow the river and kind of mitigate the impact on the shores, but also stabilizes the levees. And what they found is that burrowing mammal holes are really the most detrimental things to the levee, and the more vegetation you have, the less inviting it is to burrowing mammals. So there's kind of this relationship there with the more vegetation you remove. Anyway, so there's definitely there's definitely a lot of issues that.
But if you get an elm tree or something that's not native there.
Hazardous tree, non-native tree. So yeah.
It's probably a dumb question, but did the levees pass Army Corps of Engineer inspection last time they came through?
They did, yeah. And so that the city levies,
County too.
and the county too.
So did you say earlier that Orchard homes will be repairable by FEMA? Is that what I heard you say?
Well, yeah, we'll have to come up with a couple $100,000
To match.
But I mean, they just looked at it this week, so we haven't seen numbers. That's just what Greg told me this week.
Well, I think one of the things is the comments from the Water Quality Advisory Council at least opens up that area of comment, because it is going into the comment phase. And I know Parks and Recs is, for the city is also looking at what is the balancing point on the levees as opposed to being completely denuded.
All right, thanks, Todd.
Yeah, thank you.
All right, so with that, we move on to board and staff comments and items on the agenda.
The Milltown State Park at the Confluence opens on Saturday. The opening ceremony started at 11. So it's been a while coming. Look forward to that.
Has been, and you've been working on that for 10 years.
I'm 17.
Somebody, yeah, actually longer.
They're looking for corporate donors, I know that.
Well, the State Parks Foundation is raising money statewide, focused on different parks, trying to make park improvements, because state parks is only funded by the $6 that's on your license plate kind of thing, so it's different funding than the Fish and Wildlife Park.
If there's anything you can think of that we can use that Milltown historical money for.
Yeah, well, I think there will be some opportunity once the park is up and running for some it needs to be more historical preservation.
It does, I know. And it's very hard to keep 100,000 sitting around. It makes everybody.
I know everybody wants it.
All right, any other board or staff comments and items on the agenda? Any public comments and items on the agenda? Seeing none, we will adjourn as the Water Quality District Board and convene as the Air Pollution Control Board. And item number 1 is again minutes, and I see we do have minutes.
Anyone to approve the minutes as submitted?
Any discussion on the motion? Any public comments on the motion? Seeing none, all in favor say aye.
Aye.
So moved. All right, so then we're on item number 2, Air Quality Advisory Council update. Sarah's here, so she's going to walk us through that.
All right. The Air Quality Agenda, Air Quality Council meeting this month was kind of the Ben and Sarah show. We each gave them a presentation to their interest. Ben spoke with them, giving a preview of upcoming air pollution control program rule rewrites. We are in the process of going through pretty much every chapter in the rules. A lot of it is cleanup, fixing spacing and periods and spelling and little things like that, reference errors. But there are more substantial changes happening in some of the chapters. For example, in Chapter 7, we are looking to put in a rule that will also be reflected in Chapter 4 that says that when we call an air alert, recreational fires can't be used. Because the last time we had air alerts, I got a surprising number of people calling asking if they could have their campfire, and I had to say yes. And at the same time, we're telling people they can't heat their houses, but they can heat the outside with wood. So we want to fix that and have just a provision that says when we call an air alert or warning, recreational fires are also shut down, as well as, wood stoves and outdoor burning. In Chapter 8, in Chapter 7, we also want to look at, there's some clarification that is needed for outdoor burning season dates. There's this kind of strange way the rules are written, where right now it is written so that if you want to burn in the winter months, you have to follow the provisions in like 7.601 or something like that, which applies only to minor burners. So there's no provisions that would actually permit major burners to follow the same process to burn in the winter months in Impact Zone M that we have there for the minors. So fixing that, cleaning that up, just trying to make sure everything's really coherent and makes sense when you read it. In Chapter 8, which is our fugitive particulate chapter, Ben is looking at potentially another kind of paving that could maybe be approved for some situations. He could speak more intelligently about that because he's working on it, but it's something with different options because our paving rules are pretty old and there's been new technologies that have been developed since we defined what paving was. Also looking at providing for folks that are required to pave by our rules because they've created a new parking area or driveway to allow them to pave somewhere else the same amount of square footage or greater that would have the same traffic or greater. And what that could do is allow folks that have like a building with a pre-existing dirt parking lot and they want to make an additional behind the building parking spot for their trucks or whatever, and instead they could pave their public parking. So they're getting the same amount of paving done, but maybe it makes a bit more sense. So looking at that for Chapter 8.
Would it have to be on their own property?
No, I don't think so.
So in other words,
Yeah,
there could be
but
a road in front of you that made more sense than your driveway.
potentially, you know, and that's all it's to be looked at. And I believe that Ben has done the drafting of that rule. I can't recall what it says specifically, but it will clearly go through a public comment phase and have, if it isn't in there already, that would be something that would come up. Chapter 9 will have the most significant changes to it. That is our solid fuel burning device chapter. The main driving force for updating these rules is the 2015 NSPS, which is the New Source Performance Standards that EPA passed back in about 2015 for emissions from newly produced wood stoves and pellet stoves. Was a significant improvement over the previous standards. Our rules need to be updated to reflect those standards. The thing that we are still working through is if we should also include the 2020 standards. They are being challenged and there's potential that they will be pushed off by at least 3 years. But at the same time, so we just put something in there right now so that when they do finally become official, then they're already in our rules. So that's something to look at. But we need to update that. We also are thinking about ungrandfathering the grandfathered in stoves in their designation zone. In 1994, when those rules were passed, stoves that had been installed as Class 1 devices between like 86 and 94 with a permit from us were allowed to stay on the property, in large part because those folks had purchased at the time pretty snazzy wood stoves, went through a permitting process, followed all of our rules, and then we in 94 passed a rule saying stoves need to be removed upon point of sale. And you know, these folks who had purchased these stoves were potentially looking at a loss of value for their home, and they'd done everything we'd asked them to do prior, and so those were allowed to stay upon point of sale. It's been 24 years since then. Those stoves are getting pretty old, and a lot of them have already changed ownership multiple times. And so we're looking to simplify the wood stove removal rules in Missoula by just saying if there's a wood stove in your air designation zone, you're selling the house, or the house is changing hands, then the wood stove needs to go, and no more of this looking up or saying, well, maybe it can stay because maybe it's on file somewhere. It's just, it's a wood stove and it needs to go. So simplifying that for everyone, and also removing potentially more stoves from our air designation zone.
But again, it's a point of sale or change of hands, not just we're going to go.
Correct.
right down
Yeah.
the
We
street.
are not going to go into anybody's home and take their wood stoves. It's when a house is being turned over. And then also change the certificate of compliance process. Right now, we tried to make things simpler back many years ago with a rule change to reduce paperwork by not requiring a certificate of compliance to be filled out every time a house was sold. And what happened is real estate agents started thinking that the program just went away because they weren't required to fill out this form every time. And so there's been this kind of more confusion that needs to happen. So we're actually talking about getting the COC form put into just a whole big stack of final paperwork, not requiring extra notaries like we've had in the past, to just make it more simplified as part of the signing off, doing a whole big sign up of everything. Don't have to go and get extra people to sign it, but still have it there, but have it be part of probably every transaction, but also in a more simplified manner. And that way, we're just hoping to keep people's attention and remember that this is still a program that exists, and stoves can't just stay on the property. We're going to have a couple different ways of going at that. There may be some rules that will apply to Seeley Lake that we will go to Seeley Lake with those first, because that community needs to have input on anything that we do up there. So we aren't talking about any of that right now. But if we do anything with Seeley Lake, we'll go to Seeley Lake first and talk to the community council, talk to the folks up there before we bring it to advisory council and stuff like that. So went through all of those things. It was a lot, but we've been hinting at this rule change for a long time, so it's nice to finally bring some specifics that we are actively working on this. Ben's been doing a great job drafting things up, and we've gone through every chapter and found little punctuation things, and it'll be great. So that was Ben's part, and then I gave the council a presentation that was kind of ended up mashing a couple of my presentations I've been giving together to talk about the 2017 wildfire season, both what happened, because it was a doozy, going over the outdoor wildfire air quality data, what we saw, and what it meant to people who were living in it. And then also a pretty thorough rundown of what we did to try to help folks with getting air purifiers out to Seeley Lake and to schools in Seeley Lake and Lolo and Condon, and what happened from that, which was communities around Western Montana kind of following our lead and getting air purifiers into schools around the western half of the state. So that was really exciting. So gave them all that good information, and also have indoor air quality data from monitors that Climate Smart put out this summer, where they had monitors in the senior center and the women's club and
Indoor air?
Yeah, Amy Sillenberg's house, and the library, and Hellgate High School, and the gymnasium, and a children's museum, and an office building. And the data is both fascinating and frequently depressing. The senior center might as well have been outside, because there's just no filtration on their system. The library oftentimes might as well have been outside. But buildings that did have some filtration, even though it wasn't a MERV 13, we had a MERV 8 in the Women's Club and a MERV 8 in the Clark Park Coalition building. They had systems that were able to recycle the air. And so even though it wasn't rated for superfine particulate, it still did a pretty good job until we hit the week of doom in September, where everything was just terrible. And then those filters, it looks like they got overloaded and started being bypassed. And so the air got considerably worse indoors, even if you had recycled air through some sort of filter. But it did show that having recycled air through filtration was pretty effective. And if we can get better filters, it'll be even more effective. But the filters will need to be changed out more frequently and monitored a lot. And then Amy, who does not have air conditioning, and so she had to open her windows at night, there's this great graph that shows that on the day that it was a pretty bad day, and it got bad in the morning, she woke up, she shut her windows, turned on, she had 2 of those Winnex air purifiers, turned them on, and she had the best air in Missoula. So it really shows that you can achieve good indoor air with a room air purifier. And an industrial setting, if you have it on circulate, but if you don't have anything, you might as well be outside. And so that is an important message to have. And unrelated to this, because it's more recent, Amy and I and Diana Mena from CAPS, we met with McKinstry day before yesterday to go over HVAC systems with them and learn about what we're going to see in schools and what how different systems work, where the opportunities for filters are, what you can do to improve your system. If you're building a new system, what your options are. For example, the DirecTV, their facilities guy, he is obsessed by indoor air quality. I've talked to him a lot over the years. And he used to work for a hospital, so he knows what he's doing. He has a system set up where when it gets smoky inside, he pushes a button and the whole system goes into wildfire mode, and it stops taking in outdoor air altogether, and works to recirculate air through a filter, and while still complying with making sure there's enough oxygen, obviously, in the mix. But it's like that technology exists, and so there are options, there are opportunities to move toward having that, like what we do. So that was really great to learn about all the things, learn about what's in schools, what's not in schools. Climate Smart have been working really closely together on the whole idea of getting a smoke-rated community, and they've gone out and gotten a grant to do the community needs assessment that I want to do but do not have time to do. And so they got some funding from United Way to starting with public schools, find out what they have and what they need and what they could do to get ready for wildfire smoke, and what type of strategies might work for them. So they've started that already. They've been going around contacting the schools, and we are planning on sitting down with Mark Thane here pretty soon with his facilities folks to also tackle MCPS. So stuff's going on with that, and pretty excited for getting ready for what's going to happen. The forecast for this wildfire season is grim, so we're going to try to be ready.
That indoor air data is just amazing. And I have to keep looking forward when I look at it, because I think of all the years we told people to stay indoors.
Well, the benefit of staying indoors is you will hopefully not be active.
Yeah, you might not be climbing your walls.
Cuts down your dose a little bit. But now our message is stay indoors with clean air.
With clean air.
Yep.
Sorry, I have one note on the rule changes. This is sort of a hangover back to the U of M biomass boiler. And I'm still remain interested in having some sort of offset. I'm going to use a word here that probably isn't the right word, but like an impact fee for people who propose to add significant additional pounds of particulate into the airshed, that they have an impact fee that we can take in to help programs for changing out stoves or whatever we can do to take an equal amount of load out that they're going to add. So that dates back to those days, and we haven't had anything like that for some time, but we will again, and it'd be nice to have that in our toolkit in advance.
Awesome. I will.
We have the authority, I don't know.
Yeah.
We don't even call it that. An offset. I don't know what to call it.
We did, at one point, we talked about it as an incentive program, but I don't really remember.
But
Much more
interested
about
in
it.
exploring that.
Okay. Yeah. I think that I'll bring that back to Ben and Shannon and Anna, and we will see what all the possibilities are.
And I know last year you gave us information about if you were going to buy a HEPA filter, this is what you should buy. And could we put that out in social media and on the web again for people to start thinking about? Because I thought,
Yes.
I should probably
Yeah,
buy one now
absolutely.
instead of
My plan actually says summer starts today.
Okay.
Right. Although I've spent the day in meetings, so hasn't happened yet. To push out to my email list as a starter, and then I also want to write up something, put it in maybe to the Missoulian or whatnot. Hey, summer just started. Get ready now.
Right.
Because we had issues with them not being on shelves anymore and slow shipping times.
Or you didn't have any idea what to buy.
So this is the time to prepare. Climate Smart hasn't had a chance to update all their material from last year. Now there's new models on the market. So their new website won't be ready to go until the end of the month. I can still send them to the old one because Amy is making...
So just go to Climate Smart Missoula.
Yeah, she's making one that's good for the whole state and will have more updated information on it. That's part of what she's doing with her grant she got from the Montana Wildfire Relief Fund. And their website is just so pretty and functional, and I like it a lot. And so I like to send people there. And so I will still do that, but I am still planning on pushing something out and really trying to encourage people to get ready before the smoke hits.
And we bought more filters with that grant. What's our cache of filters right now?
Right now, we're at 166. I'm thinking I want to get up to about an even 200, and then also purchase extra replacement HEPA filters to have them on hand for.
We were talking about getting giant ones, but we didn't know if they'd kind of suck you into them or what would happen with the, but you know,
Yeah.
for some of the public spaces, I don't know.
You know,
what they mean.
there's apparently a super giant one that has just been approved or was scheduled to be approved for fire safety rating that'd be good for like gymnasiums or
Yeah.
something like that. I haven't been able to find information on it. I imagine it's probably really expensive.
Yeah. But so is a bunch of little ones.
So it's interesting. The little ones, frequently you can add up square footage for less than a bigger one. So I've been looking at that, and also like if you're in a place with halls and doorways, it's more recommended that you get multiple little ones and scatter them around instead of a big one trying to deal with the airflow in a complicated situation. And by little, like we're talking, the ones we have, they're all good for 360 square feet, so they're not that little. I've been, oh my goodness, I have been up to my eyeballs in HEPA filter stuff for a while now, trying to strategize how we want to do this in the most effective way.
Having stood in front of big fans at the Bitcoin place, I can tell you the little ones.
Oh,
are
yeah.
better.
Stick with the little ones. So we don't
Well,
have
and
that.
they're, I mean, they do have, you know, huge fans that will blow you over. Smaller.
Unintended consequences.
Thanks.
All right, thanks, Sarah. So then we move on to item 3, Transportation Policy Coordinating Committee update.
I want Debbie there every time because it was the shortest meeting ever.
I know.
The one I went to was super short too, though. It was like 30 minutes and it was
Well,
done.
we weren't 30 minutes even.
No.
It was good. So I'll give a little update, you can fill in.
Okay, yeah.
So there's just really 2 items. The first was a presentation from WGM on the, what's called Build Now, it used to be Tiger grant application and process. They're putting in a revamped version of one that's gone in before, and it's for the area out, interstate to Mullen, Reserve to the airport, to do interconnections between Mullen and Broadway on Mary Jane and George Elmer, and get all of that cross traffic squared up and ready, you know, potentially for housing developments to go in there.
It's a city-county joint application.
Right. Yeah. So that was the first item, and really the second item was consultant selection for the city's traffic safety plan that needs to be updated, and that's really going to be a year-long process to update that plan that takes all of the crash data and safety data to see where they need to focus their improvements and you know, take the data and recommendations from that and then launch into how they make improvements for safety around the city.
From a public safety perspective, that was the most interesting one because I did not realize there was that many pedestrian car accidents that occur in Missoula.
Oh.
The map was just like everywhere, and there was, you know, looked like 900 maybe or so. It was something, and that could have been multi-year. I can't remember the details now from the meeting.
That sounds like it would be.
But yeah, I was amazed at how many pedestrian vehicle incidents occur in Missoula at any given like time.
And then of course we have one this week with
Yeah.
fatality. So.
The other interesting thing in that one is they'll be looking at things like driverless cars, what do they call them?
Yeah.
As the potential of what do we need to worry about and think about, and I'm like, don't let me.
Yeah, so that was really it.
All right, well, with that, we roll on to public comments and items not on the agenda. Seeing none, board or staff comments and items not on the agenda. All right, well, with that, we will adjourn as their go board and adjourn as all 3 boards.
Thank you.
And then just a reminder that we need to keep all the stuff on this variance for
Yeah,
next month.
yes, it's sent again.